our first speaker is Dr. McLachlan, and I'd like to welcome her. She's going to be presenting on compassion fatigue and using strategies from cognitive behavior therapy, mindfulness, and acceptance and commitment therapy. Dr. McLachlan will provide information on dealing with compassion fatigue and negative emotions for caregivers. The session will give practical strategies on how to lessen the power of negative thoughts and emotions, let go of judgment, set boundaries in the caregiver relationship, and choose behaviors and actions that are consistent with one's values as a caregiver. And just a bit about Dr. McLachlan. She's a psychologist registered to provide services to adults and seniors in neuropsychology and clinical and rehabilitative psychology. She completed her bachelor's degree at Western University and both her master's and her Ph.D. in clinical psychology at Queen's University in Kingston. And over the past 27 years, Anne has provided neuropsychological and psychological assessments and interventions to a variety of different programs, including adult mental health and rehabilitation at the Western campus of Hotel du Grace Healthcare on Tate 4. And currently she brings her experience in the diagnosis of neurocognitive and psychological disorders, as well as psychological interventions to outpatients in the acquired brain injury program and inpatients on the rehab and complex medical care units at Hotel du Grace Healthcare. She also supervises clinical neuropsychology doctoral students from the University of Windsor. And with this, she's mentoring our next generation of neuropsychologists. And I've personally had the opportunity to work with Anne over the last 7 or 8 years. I'd describe her as someone who's very caring, passionate, compassionate as well, knowledgeable, resourceful. And we're happy to have her as part of our Hotel du Grace Healthcare team, again, trying to transform lives and cultivate a healthier community. So with that said, I welcome Anne, and we will kick off the first session of the presentation here today.
Thanks very much, Patrick. Can everyone hear me okay? So I'm going to share my screen now. It's always these kind of, okay, is the technology stuff going to work? Is it there yet?
Yeah, it's there.
Okay, it's there?
Yeah.
Okay, so I have to do slideshow.
Mm-hmm.
And from the beginning.
There we go.
Okay, excellent. Okay, so actually I'm kind of pinch hitting today for the psychologist who is associated with the mental health programs at HDGH, Dr. Bethany King. So I'm really happy to be able to come and present for you. Okay, so what we're going to talk about today is dealing with compassion fatigue and negative emotions. So as Patrick said, I'm a psychologist, so that means that I have a PhD in psychology. I'm not a physician. I'm not a psychiatrist. I always tell that to people so that they don't ask me medical questions. And on the inpatient unit, so they don't show me any wounds, because I really don't want to see that, right? And while I'm not currently providing services in the mental health programs, I am a mental health care provider. Okay, so what we're going to talk about today is we're going to talk about the things that caregivers are dealing with. We're going to talk a little bit about compassion fatigue. We're going to talk about self-awareness of emotions, and then I'm going to move on to talking about setting healthy boundaries and doing some self-care. So Dr. Jennifer Voth, when she asked me to do this talk, she gave me some information about the survey results. And these are the things that she told the researchers about what it's like to be a caregiver for someone who is experiencing significant mental illness or substance use. So you reported that you're experiencing emotions like feeling helpless, feeling worried, frightened, abandoned, devastated, embarrassed, and feelings of guilt. You're dealing with someone, caring for someone who has their mental illness and substance use is unpredictable. They have good times and they have times when they're not doing so well. And for many of you, you may be feeling that you're always on alert, always trying to, wait to see, is this going to be a bad day or is this going to be a good day? For caregivers, it can be often difficult to separate one's own emotions from those of the person with the mental illness. And being a caregiver can really take a toll on people's personal lives and on their work lives. And for many of you, you may in fact be providing support to more than one family member at a time. So before we get started in the information, I just want to let you know that none of this is my original thoughts. I've gone off to the research literature and some different websites to gather the information to talk about compassion fatigue and to talk about dealing with negative emotions. So I went to the websites of the Center for Addiction and Mental Health. So often in mental health, we call it the CAMH, right? The American Psychological Association. There was a website called Positive Psychology. And I have some quotes from Mark Manson, who wrote a popular book recently. Then what I've been reading recently to help me in my own therapy that I do with patients in the outpatient programs and in the inpatient programs is the Mindful Way workbook, which is Mindfulness-Cognitive Behaviour Therapy, and the Happiness Trap, which is a really gives a layperson, and for me, even as a professional, a good understanding of what's called acceptance and commitment therapy. So those are a couple of resources I would recommend following up on. So the other thing I want you to bear in mind is that for people with severe mental illness, so what we're going to talk about today is actually coping strategies and psychological techniques that are helpful for compassion fatigue, for stress, and for mild mental health symptoms. But for people with severe mental illness, medication is an important part of treatment. And medication provides a platform for people to be able to function day to day. So the way I often explain it to my patients when they say, oh, I don't necessarily want to take a medication, I talk about the medication helps you to be in a place where then you're able to function day to day, you're able to learn coping skills, and you're able to participate in other types of therapies. Okay, so now we're going to move on to some of the content. So what is compassion fatigue? And there's a lot of literature that talks about compassion fatigue in professional caregivers, but there's also some literature that talks about it in unpaid caregivers as well, because that's what family members are, right, is unpaid caregivers. So compassion fatigue occurs when we start having difficulty feeling empathy for the person that we're caring for. And we may have feelings of helplessness and powerlessness, and that may lead to us having difficulty sleeping and experiencing emotions like irritability or anger, sadness, anxiety. And we may start to pull back from our social connections and become socially isolated. And we may, in fact, also start using things like substances to help us cope with some of these negative feelings and emotions. So what causes compassion fatigue? Why do we develop that? And that's because we're constantly being exposed to another person's emotional pain, and we're trying to relieve their suffering. And another reason why we might develop compassion fatigue is because we're focusing on providing support to others and we're neglecting our own physical and mental health. Okay, so I want you to think about compassion fatigue. Doesn't mean that you're a weak person. It means that this often happens to caregivers, and it can be a normal thing that happens to caregivers. But there are things that we can do to reduce compassion fatigue. So I'm going to talk about 3 things to do to help reduce compassion fatigue. The first is becoming aware of negative emotions and the fact that you may be experiencing compassion fatigue. The second thing is to talk a little bit about setting healthy boundaries. And the third thing is to talk about engaging in self-care. Okay. So what we're going to do now is we're actually going to do a little exercise. So I'm going to encourage you to sit upright wherever you are with your feet flat on the floor, your shoulders down your back, and you can have your hands either on an arm of a chair or on your lap, whatever. And if you want, you can close your eyes. And we're just going to do a little breathing. So first we're going to sit and we're going to focus on our breathing. Focus as the breath comes into our body and down into our abdomen, and then as it goes out again. And you can feel it going in through your nose, and your abdominal wall moves, and then the breath goes out of your body. And just focusing on breathing in and breathing out. And as you're breathing in and breathing out, becoming aware of the physical sensations in your body. How does it feel sitting on the chair? Do you have any tightness or tension? Any pain? Maybe butterflies in your stomach? And just continue breathing in and out. And then you might focus on the emotions that you're feeling. Maybe you're feeling curious about how things are going on today. Maybe you're feeling worried. Maybe feeling anxious. And just noticing those emotions that you're feeling. And then being aware of your thoughts. And those thoughts might be, oh, I wonder how long she's going to go on with this breathing exercise. Or some other thoughts. And then shifting and returning the focus to the breath. Breathing in and breathing out. Breathing in through the nose and feeling the breath in your abdomen wall as it expands as you breathe in, and then it's contracting as it breathes out. And now if you find that your mind wanders off from the breath to physical sensations, to emotions, or to thoughts, just gently acknowledge them and gently bring your mind back to the breath, being present in the moment and focusing on the breathing. Breathing in and breathing out. And a few more breaths, so breathing in and breathing out. And then you can open your eyes again. So how was that, huh? Well, now I feel more relaxed. I feel less nervous about giving this talk today. So what we just did was some mindfulness breathing. And mindfulness breathing allows you to be aware of your emotions and to see what physical sensations occur along with them and the thoughts that are going through your head as well. So one of the things we want to do is become aware of those negative emotions and figure out how they're tied into what we're thinking. The breathing, because we shift from those physical sensations, we shift from the emotions and the thoughts, it allows us to be present in the moment. It allows us to see that there is space among our physical sensations, our emotions, and our thoughts. And then it allows us space before we act or react, right? Because so often, right, we have a physical sensation, we have a thought, we have an emotion, and boom, we react. And sometimes we react in ways that we don't want to react. And that becomes an automatic, kind of thing. But by disentangling these emotions, these physical sensations and these thoughts, then it allows us some space to act or react differently. So what are these? I got to go back. What are these emotions? So we have 8 basic emotions: surprise, fear, anger, disgust, sadness, anticipation, admiration, joy. And I found this emotion wheel by some research by Robert Plutchik, and there's lots of different emotion wheels. Like we have thousands of different emotions, and they often are a combination of these 8 basic emotions, right? So love is a combination of joy and admiration. Guilt is a combination of sadness, disgust, and surprise. So the goal when you become aware of these negative emotions is not to avoid them, not to avoid these negative thoughts, these emotions, or these physical sensations, but rather to accept them and then choose how to act. Emotions are mental sensations that we have, but they're not necessarily who we are. So our emotions are valid. So it may be quite valid to have negative emotions of sadness. It may be quite valid to have a negative emotion of anger. That's telling ourselves that something's going on wrong here. But we can choose how we're going to act on those emotions. And we can think about, I'm feeling angry, but I'm not an angry person. So emotions are neither good or bad. It's just as okay to have emotions like anger, grief, and anxiety as it is joy, curiosity, and love. If you fight with these negative emotions, right, you struggle and you spend a lot of time trying to, fight with them, they can overwhelm you. And if you try to push them away and avoid them, by eating a tub of ice cream or by drinking excess of coffee or going off and spending a whole lot of money on shopping, right, or just to kind of repress them, they can hop out and ambush us. And then they're often harder to deal with. So what we want to do by acknowledging our emotions, even these negative ones, and also the positive ones, if we sit with them and we breathe a bit, we notice that they ebb and they flow like waves. So these emotions are different than a mood state like sadness, a mood state like anxiety that lasts all day long, several days, a couple of weeks. These things we can see, they come and they go. And then when we notice that, then we can decide, am I going to change the way I think about this situation? Am I going to change the way I'm going to act or behave? Or am I going to change the situation? So that then we don't have this automatic thing of thought, emotion, and reaction. We can slow down and we can put some space in between them. And then we can choose how to act despite the emotion of anger, anxiety, or sadness. I know it's a lot to think about, right? I really kind of struggled to there's probably like about 8 hours of information here to distill it down into a few minutes. So emotions come from thoughts. Anger comes from the thought that this might come from the thought, this is so unfair. And what we want to do is start to separate ourselves from these thoughts. This is a thought that I'm having. And recognizing that thoughts are not always facts. Quite often, thoughts are opinions, they're judgment. And so sometimes by kind of sitting for a minute and allowing some space, we can ask ourselves, is this thought I'm having, is it a fact? Or is it an opinion, right? So for example, you might think that is a blue shirt, or you might think that is a very ugly blue shirt. Well, that is a blue shirt is a fact, right? The shirt is blue no matter what. Whether or not it is ugly is an opinion. It's a judgment. So how do we cope with negative emotions? By thinking differently. We can change the way we think by letting go of judgment. We can be open to thinking differently about the situation. So instead of jumping onto a negative thought train, we can stop and we can start to think differently about things. So then we can avoid negative thinking traps like all or none, like mind reading or catastrophic thinking. And by thinking differently, we can start to become aware of what's within our control and what's not within our control, and focus on the things that we can control. So another way we can act differently is by setting healthy boundaries. And so Mark Manson, on his website, I like the quote he put out. He says, healthy boundaries are taking responsibility for your own actions and emotions while not taking responsibility for the actions or emotions of others. And setting healthy boundaries involves identifying what your own values are, and then acting in a way that is consistent with your values. And it's really important to recognize that everybody has different sets of values, right? We don't all have the same values, and that's okay. It's also important when you are setting healthy boundaries to clearly communicate what you need and keep it simple. Don't go into long explanations. And you have to establish rules and consequences for those boundaries. So I'm going to talk a little bit about values, and then I want to talk about some examples for setting healthy boundaries. So we have different areas of our lives. So in acceptance and commitment therapy, they talk about a value-led life, right? Doing things in consistent with our values. And they talk about a number of different aspects of our lives, right? So it might be in terms of personal relationships, family relationships, work, recreation, physical and mental health, spirituality. Those are all different value areas. And then we have values within them. So within family, I picked a couple areas here to talk a bit about. So in terms of family relationships, for example, and here's some different types of values. They're not always they're not the same value. So for some people within family relationships, they may value having a supportive, loving relationship. And then they may set some goals, things they can achieve that fit with that value. Other people might, for example, value things like independence and privacy. And they might set some goals or set some boundaries that fit with those values of independence and privacy. For other people, it's all about being spontaneous, right? Or having shared interests. So then they might set boundaries and goals that fit with those values of spontaneity and shared interests. At the same time as those family relationships, you have an area of your life that might be physical and mental health, for example, right? And your values around that might be that you're able to deal with a crisis, so then you might look at things and boundaries that help you with that. You might want to be able to experience a range of emotions. Physical health wise, you might look at, I have a value of I want to have physical endurance. I want to be able to kind of keep going all day long. And for other people, they might have a value of good cardiovascular health. So with setting healthy boundaries, what we want to do is decide when, where, and for how much time we're going to provide support, and then communicate those boundaries. At the same time, we want to respect the other person's boundaries, and that will involve asking about their needs and respecting their limits, right? So for example, we might say something like to the person we're caregiving for, I'll talk to you every morning, but please don't call me after 11 p.m. I need my rest. But let's think about who else you could call late at night when you need to call somebody late at night. Or you might have a rule, there's no smoking in the house. If you need to smoke, then please go outside and do that, or please go out into the garage and do that. That's setting a boundary, right? Around something as simple as smoking, for example. Another boundary might be in terms of when I'm feeling really angry right now, but this problem is important. So let's talk about it in an hour after I've calmed down, right? So then you've set some boundaries around how you're going to talk about a problem or an issue, and recognizing that if you're in a state where you can't talk in a kind of a good way, that you're going to take some time away to take care of yourself and calm down so that you can come back and solve the situation in a way that's going to be beneficial for both people. So when we set healthy boundaries, it helps us to remember that the behavior of the person we're caring for is not a reflection of us. And we don't need to match another person's sadness or match another person's anger, right? When we set boundaries, it doesn't mean that we can be mean or disrespectful of other people. No, we still have to act in a respectful way. And we can also care for another person, but be separate from us, right? So I put a picture here of Winnie the Pooh and Christopher Robinson going to see Eeyore, right? And Eeyore is always very sad and very down. And his friends support him, and his friends support him just by being there. Another way we can reduce compassion fatigue is by engaging in self-care. And engaging in self-care can be a way of setting healthy boundaries. So for many of us, we have to change our thinking about self-care from being something that is selfish to something that helps to recharge ourselves both emotionally and physically. And self-care means doing something meaningful that fits with our values. So the American Psychological Association recommends 5 important self-care activities. So one of the things they recommend doing is incorporating relaxation into your day. So how do you know you're doing something that's relaxing? So any kind of relaxation exercise helps us to dampen the sympathetic nervous system, the fight, flight, or freeze response. So what the sympathetic nervous system is that when our brain says danger, 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 right? And it's often when we're in a lot of stress, or we're, crossing a street and a car comes around the corner, we have to run across the street as quick as possible. That's the fight or flight response, okay? Our heart rate goes up, our breathing gets more shallow, our muscles all tense up, our adrenal glands secrete stress hormones, our digestive system shuts down, our sensory filters open wide up. And that's really good when you have to run away from some big dog or jump out of the way of some speeding car, but it's not so good when it's turned on all the time. And you know that you're doing a relaxation exercise when you kick in the opposite part of the autonomic nervous system. When you activate the parasympathetic nervous system, the relaxation response. And you slow down your breathing, your heart rate goes down, your muscles relax, your digestive system starts up again, your sensory filters go back to normal. And that can be triggered by doing activities such as deep breathing, listening to calm music, watching the birds at the bird feeder, or doing some walking where you're paying attention to this, to the environment and what's going on around you in terms of the colors of the trees, the light, and other things on the street. So I thought what we would do right now is a little breathing exercise for relaxation. So earlier we did a mindfulness breathing exercise, and the focus there isn't necessarily to get to relaxed state. With the mindfulness breathing exercise, the focus is really being able to be aware of emotions, thoughts, and physical sensations, and being able to shift your focus to your breath and finding a space to breathe around those things. with this relaxation exercise, the whole focus is to relax the body. So it's, there's lots of different breathing exercise, and the purpose of it can vary from time to time. So here our goal is to relax our body. So for this one, this is an exercise I do a lot with my patients. What we're going to do is we're going to count from 1 to 8 as we breathe. So again, you get in a comfortable spot. You want to bring your shoulders down your back so you open up your chest to get oxygen into your lungs. And as you can close your eyes if you want. And as you breathe in, you're going to count 1. And as we breathe out, 2, and so on up to 8. So let's get comfy, close our eyes, and breathe in as 1, and hold, and out is 2. And in is 3, and out is 4. And in is 5, and out is 6, and in is 7, and out is 8. And do it one more time. So breathe in as 1, and out is 2. And in is 3, and out is 4. And in is 5, and out is 6, and in is 7, and out is 8. So that's a nice little exercise that you can use. Do it several times for maybe 2 or 3 minutes to help relax your body if you're noticing a lot of tension, right? If you need a little mental break in the day. Another form of self-care is getting adequate sleep. So it's really important, to make sure that you're getting your regular sleep. Sometimes that's for some people 6 hours. Sometimes that's for some people it's 8 to 10 hours of sleep. Everybody's a bit different. So what you want to do is have a regular time that you're going to bed. And more importantly, you want to have a regular time that you're waking up every day. And if you're having troubles with insomnia, trouble sleeping, you really want to stick to that regular wake up time 7 days a week, and then going to bed when you're tired. Trying to reduce napping so that you might only have a nap a day for maybe about 20-30 minutes. It's also helpful to have a regular bedtime routine. So that can involve, having a snack, listening to some quiet music, doing your kind of bathroom routine, brushing your teeth. And it can also be helpful to set aside some worry time during the daytime and not doing all that worrying or thinking about the next day or the stuff you have to accomplish this week just before you go to bed. So often I encourage my patients, to take some time, usually in the late afternoon, where they're going to kind of plan and go over what's happening in the next day, things that they're concerned about, maybe doing some of their journaling, so they're not just doing that before they go to bed. It's also helpful to have a dark, cool room, right? And I always tell my patients, okay, there's only 2 things you should be doing in bed, and they both start with S. All right. So don't be eating pizza, going on the computer, watching TV if you're having trouble sleeping. Your bed is for sleeping and for sex. So the last couple of self-care activities involve eating healthy and physical activity. So it's really important to fuel our body and our mind by eating regular meals that are healthy. And eating regular meals also helps to set our sleep-wake cycle as well. You want to stay hydrated, and you want to avoid excessive use of substances such as caffeine, alcohol, cannabis, and even that can be, not eating that bag of cookies or not eating that tub of ice cream as well. You also, in terms of physical activity, it's really helpful to incorporate daily physical activity, such as a walk, dancing to music, or taking the stairs. So one of the things I do to make sure I have DPA, And I got that term from when my kids were elementary school, and they used to have this DPA thing every day, is I park at the back parking lot and I do the long walk into the hospital. When I go on the hospital, I take the stairs up to the units rather than taking the elevators. And if you're going to do more demanding exercise, it's important to set some realistic goals around that, about if you're doing things like biking, running, or lifting weights. But even just a basic thing like a walk around the block, a walk every evening, a walk a couple of times a week, it can be so helpful to us both on a physical level and on an emotional level. The last thing I want to talk about in terms of self-care is maintaining social connections. So one of the things you can do is to create a community and connect with other caregivers. So last Saturday, I went on to the conference because I wanted to see, okay, you know, what's the presentations like? What's the, you know, what are people commenting? And I was really touched to see how much support people were providing to each other in the chat. I really thought that was awesome. And I think this is a really good opportunity for people to connect to each other. And I think it's important when you're connecting with a community of caregivers is you don't want to fall in the trap where you're just venting about all the bad stuff that's going on. It's important to do that, right? To kind of to vent that, to grieve losses or difficulties. But it's also just as important to talk about the positive things and to help problem solve through situations. And by connecting with a community of caregivers, you're able to find out, ways of navigating through the system. Maintaining social connections also means visiting with family and friends outside of your caregiver role. And that may be as simple as making telephone calls, doing video chats, or even, you know, the old-fashioned way of writing some cards or notes at times. And then, you know, another idea for maintaining social connections is staying involved with groups such as book clubs, you know, coffee times, or faith communities as well. So in summary, what we've talked about this morning, just kind of touched on briefly that it's important to be aware of compassion fatigue, that it happens to a lot of caregivers. It's something that can be a normal part, but once you're aware of it, then you can do some things to reduce that compassion fatigue. And that negative emotions are as valid as positive emotions. And then you can be aware of them and choose how you're going to react when you have those negative emotions. You can decide at that point if you want to change your thoughts, change your behavior, or change your situation. And sometimes changing your situation means, as caregivers, doing the advocacy work that you're doing and connecting with other caregivers. We can also deal with compassion fatigue by setting healthy boundaries in our caregiver roles, and by also engaging in self-care. And the final thing I want to leave with you is that be kind to yourself. Expect that you're going to make mistakes, that you're not going to always get it right. And you're going to fail, and that's okay, because then we just get up, right? We take a look to see what worked, what didn't work, and try again. And it's a lot of practice, practice, practice. So I want to say thanks today for inviting me to participate in this, and I'll take any questions at this point.
Dr. Ann, thank you so much fantastic information. Thank you for sharing. And you can see that so many people are sharing their own strategies in the chat. It's fantastic. I encourage everyone to pull up the chat and take a look. We do have a couple of questions here for you. And if we don't have enough time to answer your question, pop it into the chat and we will get those answers for you. We will send out a communication to all of our audience, making sure that you get the answers to your questions. So the first one for you, Dr. Ann, is when you live with someone who has a mental illness, how can you set those boundaries when you're with them all the time?
Oh, that's pretty tough, isn't it? So I guess it's in terms of carving out some space for yourself, right? So that might even, and part of it is the way you think about it, right? So you might think about even going for a walk, right? During the daytime sometimes is a way of carving, is putting a boundary on it. That's a way of doing some self-care, okay? And in terms of, you know, spaces within your home, I guess, if you can, you know, say in terms of, okay, the bathroom, when I'm in the bathroom, right? That's a time when I need to be alone. Sometimes people will do those sorts of things, or they might, you know, set some boundaries around activities. So they might say, okay, I'm watching this particular TV show. This is my time. So when the TV show's on, no, you know, I'm not going to have any interruptions. You can't talk to me, right? So kind of those might be some ideas for setting boundaries. I don't know if maybe other people have some ideas about that.
I'm sure that folks will start putting some stuff in the chat. I know I've learned so much already, so I appreciate everybody who's using that function. One more question for you, Dr. Ann, and then I'll probably turn it over to Patrick just to keep us on time. What do you recommend for those who are experiencing anxiety during those breathing exercises?
So that's important, right? Is that when you do things like mindfulness, you become more aware of those emotions, right? So, you know, I was reading some research lately that talks about, you know, we've gone on this mindfulness kick, but it's not always appropriate all the time. And you might need to look at, if you're experiencing a lot of anxiety and distress when you do those types of things, that might not be the activity to do, right? That meditation, that mindfulness breathing might not be the thing to do at that time. You might shift and do something different. So then you might think, okay, what I need to do is I need to walk. So I'm going to go for a walk, for example, right? I'm not going to sit and be feeling anxious. I'm going to do something physical, and that might help to reduce some of those feelings of anxiety, for example. And the other thing I forgot to mention, and that I do want to mention, is that, you know, as caregivers, we also need to maybe see someone, right, to talk about some strategies. And that doesn't have to be a long commitment in terms of counseling. It might be a few sessions to get some brief strategies to deal with, you know, things, and then off and on at different times.
What a wonderful reminder for all of us, really. And thank you so much, Dr. Ann. So appreciate you taking the time out this morning to be with us. I'm going to pass this over to, oh, sorry about that.
Oh, I'm really glad to be able to come and do that.
So are we. I'm going to pass this over to Patrick.
Thanks so much, Dr. Ann McLachlan and Jen. When I'm, you know, I've been following along with the chat, and I thanks Ann for presenting all these helpful strategies, and clearly they resonated with people in the chat. They said that they've used these before, and then there's other experiences where people have weighed in on some unique things that they do or they found to be helpful. And I'm reminded of something that I've experienced quite often in mental health and addictions, and that's that everyone's experience is so unique with mental health and addiction. And I see this a lot in sort of care pathways, or what people find as relevant to them in their journey with mental health and addictions. And I think that's one of the reasons why, or the main reason why, that overall, from a leadership perspective, the goal or the overall intent is to create a menu of options for people, a suite of options, a continuum of services for mental health and addictions. And I think all of these comments, they resonate with me, and they push us to offer that suite of tools, recognizing that different things work for different people. So I thank everyone for sharing what works for them. And I think this is the important part, and Ann mentioned it, about creating those connections and learning what works for other people and applying that to someone's individual circumstances. So once again, thank you, Ann. We hope you have a wonderful day and weekend. And we're going to move